Our next question is for you, Dr. Bill. Why does coronavirus affect some people really badly and hardly seem to get others sick?
Uh, that's an important question to talk about. Let's talk about what we're seeing so far, and then we'll get into that. Uh, yes, it looks like this virus disproportionately affects certain parts of our population more than others. And we're seeing those patterns be fairly predictable across the world, actually. So, one, the factor of age, uh, over the age of 60, over the age of 70, over the age of 80. In fact, the risk tends to get higher the older you get. And so that alone is a risk factor. We also have seen that the risk is higher with certain conditions that you might have. So coronary artery disease or cardiovascular disease or diabetes are two that are talked about a lot. History of cancer, history of hypertension, any sort of immune disease, that compromises your, your immune system. Those all tend to be factors as well. And I think what has what has all this in common is what I just said is the immune system.
Mm.
Some people, by virtue of age or by virtue of the medical conditions they have, their immune system is not as rigorous or able to fight off or fight this virus as effectively as other people. And so and first I'll tell you the usual clinical course is a person who gets exposed to this virus who's going to catch it. Usually it's 4 or 5 days after they get exposed to it that they actually begin to have symptoms, if they're going to have symptoms. Then, interestingly, 4 to 5 days after that, they're either starting to sort of turn the corner and feel better, or they're really starting to get worse. And that seems to be pretty predictable. I've talked to a lot of people in the hospital settings. They're seeing that pretty predictably about day 8 or day 9 or day 10 is when either things are going to get better or get worse. And again, it's folks that seem to have immune issues that their immune system doesn't respond as aggressively. 2 or 3 other things I want to mention that seem to be showing up as risk factors. Smoking. It looks like people who have a history of smoking are going to be at higher risk. And another one, folks that have morbid obesity, that's measured as a BMI greater than 40, have almost double the hospitalization rates compared to those below. Again, we don't understand completely the immune phenomenon that's going on, but we believe that it all has a common pathway about your immune system's ability to recognize this invader, to attack it and to kill it, as opposed to really things getting out of whack. So I'm going to put a little plug in as a former family physician. This is a great time to do the sort of self-care things that keep you as healthy as possible and help your immune system stay as healthy as possible. What is that? Having regular sleep patterns, eating healthy, having a regular routine. If you smoke, quit. And kindness. I know that sounds, people like, what's he talking about? I think having kindness and a good attitude towards those people who are around you, because this is a very stressful time, also has an impact, a studied and known impact on your immune system as well. So we're going to learn more, I think, as we get more data. But clearly, people who have other comorbidities is the fancy word we use for people with other medical conditions, do put themselves at a higher risk. And back to what Katie was talking about with social distancing, it may be going forward that as some of the requirements get relaxed, what you may see is those folks who have a higher risk with a lot of the conditions that I mentioned at an older age, we might continue to ask them to stay socially distanced or restrict their movements in order to protect them, because it may make more sense for them than folks that are at a lower risk.
Right, right.